Where were you 1 year ago?
It's funny you asked that, Ursula. I was looking at my calendar exactly 1 year ago today. I was in Congressman Hurd's office with members of our delegation discussing with him what we could expect from the evacuation missions of Americans from Wuhan and the cruise ships that were expected to arrive at JBSA. So we were just beginning to understand that Joint Base San Antonio and San Antonio in general would be affected in some ways by this novel virus that had been discovered in China.
That was pretty shocking that the first people to arrive in the United States with this virus were going to come to San Antonio.
Well, you know, I think we were both surprised. Why San Antonio? Why were we picked to bring them here? And I don't believe either one of us really understood the implications of that when they first came. We knew there was a problem. Didn't know how big a problem it was going to be, but we did know we didn't want them in our community. We wanted them to stay right out there at the base and to be secured there, and we supported the efforts of the military to help them, but I think it caught us all by surprise when they started coming here.
I think that feeling as just a citizen of not knowing what this meant, how contagious is it? And we didn't have any answers back then. So it kind of felt like, why us? And, you know, what's going to happen? There was so much uncertainty.
There was a lot of uncertainty, and we really didn't know the implications of this virus, what it was going to do. We'd had two early iterations of it in the past, and it did end up killing quite a few people, but not anywhere near as much as this turned out to be. And a lot of people just didn't worry about it at all. Oh, it's nothing but the flu, but turned out it was a heck of a lot more than the flu.
In that era of uncertainty, you know, you were the mayor at the time. You'd never encountered anything like this.
We certainly didn't foresee the impact it was going to have in terms of disruption of our normal schedule, of our economy, of human health in the way it has. You know, when we talked about the evacuation mission, it was really just supporting the military to ensure that we could evacuate Americans and as the judge mentioned, quarantine on base, make sure that we protect the general population from what was happening on the base. You know, and I think very soon after that, through the course of February, we began to realize that this was going to have much more significant impact on our daily lives than simply just a mission support activity for the military.
Do you remember when the first community transmitted case happened?
I do.
I mean, that was the moment, I think. I remember doing the live shot and saying, here we are.
Things changed the weekend that the CDC mistakenly released a patient who was still waiting for a test result. And I think that got all of us collectively sat up in our chairs, recognizing that even if things went well with a quarantine mission, the potential for this disease to be spread in the United States was very real. So I do remember the first day we had a community infected patient, and that was the same day we announced the cancellation of Fiesta. March 13th, I think it was, and from that moment on, it's been a mission to quickly identify, isolate, and minimize the ability for this disease to spread in our own community.
Nelson, what would be, in your mind, the thing you wish you'd known then that you know now?
Well, I do remember when they mistakenly released someone out, and we were very upset about it. And in fact, we put in, I think it was our first emergency order, I believe, prohibiting that. And I remember they went to North Star Mall. The mall ended up having to close for a day or two, I think, as they sanitized everything. She was at a motel too, I think. And that to me was the first time that I really thought, hey, this could be a real problem for San Antonio, because they were out in the community. But still at that stage, I don't think, at least I had no idea how devastating it would be.
The lesson that you've learned since then that you wish you'd known back then?
Well, it was not just me or the mayor, it was out of Washington too. Very terrible mismessaging coming out of Washington. Even the CDC did not recommend face masks when it came out. And we thought, that's very strange, because even back in 1918, when we had the flu epidemic that killed millions of people, even then they finally knew they had to use some kind of a face mask or something. So there was a lot of mismessaging that came out of Washington. Trump administration played it down like it wasn't a problem. A lot of my friends were calling and saying, hey, this is nothing to worry about. I think when the first 100 people died, they said, well, that's all that's going to die, no more than the flu. We far exceeded the number of people that died locally from the flu.
Where are we at on that?
We've lost over 2,100 loved ones and neighbors to the disease, at least, because there are several more that are under investigation that are reported just through death certificates to the state that we make sure are as a result of COVID-19. As of today, we've had nearly 180,000 residents who have come down infected with coronavirus. So it has taken a serious toll and a deadly toll on our community. And I agree with the judge. I think one thing we didn't know then, but we found out real quick, was that there was going to be such a discoordinated response to this when it comes to federal, state, and then ultimately local. And as you saw, at least in the first several months, and even up to now, the local communities are the ones that are having to bear the burden of responding to the pandemic.
If you could go back in time and be mayor again in March when that first community case was known, would you have done a local mask mandate?
Yeah, I think everyone would have. I can't speak for others, but I'm sure that even the CDC, as the judge mentioned, would say, you got to wear a mask. But at the time, they were saying, probably don't need to. And we're actually dissuading people from purchasing masks because at that time, they weren't readily available. And we didn't want to take supply away from our medical professionals who were upfront and personal with this disease.
If you feel the same way, Nelson?
Well, yeah, I wish I had the dates here in front of me, but I believe it was sometime in March, I'm not sure when, that we put in our first emergency order. And there was a lot of, stay-at-home initiatives. We had a mask mandate for everybody, $1,000 fine if you were caught without a mask. That applied to people, individuals as well as to businesses. We had a very strong protection plan, and we were very, very successful. But some mistakes were made at the state level, taking away our mask mandate, moving a little too quick on some other issues, and bang, we got hit real hard during the summer.
We ended up going with hospitalizations and ventilators. That was the big scare early on, that we would not have the hospital space, nor the equipment, nor the medicines. San Antonio appears to have handled that part pretty good. We've never been at capacity.
Yeah, and that's a credit to teamwork. And that's one of the takeaways from this entire ordeal, is the level of teamwork we've seen between the city and the county, between businesses and our public sector, between the educational institutions in our community, and amongst the hospital system itself. They have a lot of ability to move personnel, move equipment, move capacity to adjust as the pandemic started to rage. And I'm reflecting on your previous question, Ursula. I think one of the lessons, the takeaways that perhaps if we knew this 10 years ago, we would have been doing, and we're doing now, is encouraging people to go into the healthcare field. Through the work that we've done together, we're now focusing on training people for careers. One of those career fields is healthcare. We need registered nurses, we need respiratory therapists, we need people who are in the healthcare field, which are going to become even more demand, not only to respond to pandemics like this, but to keep the health of our community at the forefront of what we do.
So that would be something that really hasn't been discussed much. What preparations would you have made back then had you known what you were going to need? And that would be healthcare personnel. We knew we had a shortage even before this pandemic.
Yeah, and I think, as the mayor said, our hospitals responded. You know, we're responsible for the Bexar County Hospital District, and then you got private hospitals. So we had public hospital, private hospital, STRAC, Eric Epley coordinating where the patients would go. Tremendous effort was made by all of them, and responded to it. We hit a high of 1,267 on July the 13th in the hospital. We were still, that was this summer, it got worse in the winter, this summer, and the hospitals handled it and did a terrific job, I think, and we're very fortunate. We had CEOs of hospitals that really responded to this.
When I was telling people I was doing this story, they said, let's talk about vaccinations. Why is it University Hospital has managed to seamlessly and professionally get the vaccine out without even a hiccup?
You know, of course, we're very proud of it, and it's one of our biggest responsibilities of the Commissioner's Court to make sure we point the right people to run it and that we have the right resources. And George Hernandez and his team are very, very professional. And they worked with us all the way through, and they came up with the idea of doing a mega site. And the mayor and I were out there the first day. We started doing Moderna, I think it was, downstairs at the Wonderland. And of course, they're all healthcare professionals, so they were well organized. They knew how to give the shot. Mayor and I went through and we looked at the little tiny tube and how they had to pull it out and put it into the syringes. And but they were all professionals, and it's gone very, very smoothly. And then the city came along and opened up their site at the Dome. So we had two very big mega centers, and with WellMed is supplementing that. So we were way ahead of a lot of other people in the country.
Yeah, kind of an example of how it's done. The hiccups, though, have happened at the Alamo Dome and at WellMed, where appointments were made, but shipments didn't arrive.
Yeah, and that's one of the challenges, and one of the value sets that we're approaching this vaccination process with is that we don't want to sign up for people, we don't want to sign up appointments and then ultimately have to turn people away. That's why it's been very difficult with the very short supplies that we're receiving from the state government to go ahead and move this vaccine through. But what I will say is that, and the judge pointed this out, we were the first, I think one of the first cities in the country to set up mass vaccination sites. Now the rest of the healthcare community has recognized that that's the way we got to go, and so they have been distributing now to mass vaccination sites all throughout the state and throughout the country. The other thing that we've been doing very well here in San Antonio is recognizing that there are people who don't have access to the internet, who are disadvantaged, who are homebound. We have been making sure that they have equitable access to vaccines. And just yesterday, we started rolling out vaccines that are being given to seniors who are homebound, who cannot move from their homes, who are dependent on Meals on Wheels for food. We're sending EMTs along with them to make sure that they're vaccinated, knowing that they would suffer the brunt of the illness should that be transmitted to them.
And that brings up another point. Judge, when the vaccines first became available, a lot of people said there is not any equity in how it's going to get distributed. The people who tend to get this disease the most, the ethnic groups, the socioeconomic groups that are hardest hit by this are not going to be, should be getting more instead of the same amount as everybody else.
Well, again, the big decision was by the city to put it into the Dome, which couldn't be any more centralized for the low-income areas than where the Dome is. Then we also made a deal giving vaccines to WellMed on the south side and west side. I think they were doing like 1,000 or so a day. We were doing like 1,500. So there was that outreach program. Second thing was that VIA started giving free rides to anybody that needed to get to a vaccination spot. Great idea of what the city is doing now, going to homes for those that were not able to get to a site. So it started out, and now it's starting to kind of spread out pretty darn good.
Kind of filling in the gaps.
Yes, filling in the gaps, and but it's all a function of how many vaccines you've got. And there was just an announcement now that CVS is going to get some, but it's been a limited supply, and so that's what's been so difficult, as the mayor said.
Let's talk about the cancellations that have had to happen. So many businesses that have relied on crowds are suffering, and they want to see light at the end of the tunnel. Any light?
There is light. There certainly is light, and we're starting to see that now. In fact, the hardest part of this whole ordeal, certainly when we started, was just not knowing where the ground was. We were crash landing a plane and we couldn't see the ground. Well, we see the ground now, and it's dependent on immunity. It's dependent on us getting the vaccines out. Of course, we need the supply to do that. But canceling events, this has been a blow to business, to our economy. It's been a blow to our morale. So you can believe me, there is excitement and anxiousness to get back to this. But I think the judge and I both have had the philosophy from the start that in order for us to have a healthy economy, it starts with healthy people. And that, to me, is what will allow our city to be stronger when we get through this. And credit to the business community, small businesses in particular, the restaurant community. They have been looking at the health guidance and really changing their entire operations, how their businesses work from when you walk in to when you get served to when you walk out. They have been changing their business models to accommodate this. And we have to do our part also to provide for the funds that we're receiving from the federal government and some from the local to help continue their ability to operate. But I will say this, based on the conversations I've been having with peers across the country, and we're all suffering in the same boat. San Antonio, because of the decisions that we've been making and the proactive nature of our response, is on a foundation, as strong a foundation as any in the country to come back stronger after this pandemic is over.
What do you think was the worst thing you had to cancel?
I'll go.
Go ahead.
The natural answer will be something like Fiesta. But I'll be honest with you, what's harder is to see schools having to cancel graduations and people having to postpone weddings because of the pandemic. That's the hardest, And I would say even more devastating than that is what the healthcare community has had to go through, knowing that people at the end of life with loved ones around them have to see their loved one through FaceTime, not being able to be there. There's a lot of things that that we've had to cancel, but the human element of this has been devastating.
Well, schools. It was devastating to a lot of young people in the spring when they closed the schools, and then they began to offer some technical assistance where you could do it at home, but many students didn't collect to that. I know, like in San Antonio Independent School, they lost 10%, lost them. They just couldn't find them anymore. And so it's been very devastating toward education. Now, the thing that we're learning as we go along, that the kids are probably safer in school than anywhere else. Although you can get it, we know that. Somebody else can bring it there, but the CDC came out just, what was that, not very long ago, saying kids ought to be in school. They're safer there than running around the streets or some parent trying to keep them in the house. They're not going to stay in the house all the time. And so we're learning, and the schools are learning. The really, really good ones put in all the necessary paraphernalia that they needed to protect the kids and the teachers. So we've learned a lot about that, and I'm so glad to see that they're getting back in school now.
You bring up a point, though, and it's personal for me because my daughter has struggled terribly with all of this. She's a public school student, and she's been dealing with depression and anxiety, and it's, from what I understand, an epidemic at this point. As the mayor said, a high human toll but what is going to be the lasting effect of this? What is the thing that we're going to have to work really hard to get back?
Well,
What were we lost?
First of all, you're right in what you say. We had a big jump up in protective orders that spouses were asking for. We saw that shoot up. We had to bring in more attorneys to be able to handle that. And people being confined to their homes, as you stated, it was mental problems, and we've seen it. Clearly, we've seen that. And so what we're seeing today is that they don't have to be confined to their home, but they do have to be extremely careful when they do go out, keeping the social distance as we are right here, or wearing the mask when you're closer, or the sanitation. And we're dealing now, and people need to understand this, we're dealing with some things we don't know about yet. We know that there's an iteration of the COVID in Brazil, South Africa, United Kingdom that spreads 50% faster, maybe more deadly than what we have now. And we know it's in the United States. We don't know for sure whether it's here or not, but that's something we're still having to deal with, and that's why we still need to be so careful, maybe even more careful now than we have been in the past.
How about you, Mayor? What do you think we've lost that we're going to have to work really hard to get back?
Well, I think you're absolutely right. The summer slide that was confined to 2.5 months previously has now been experienced for over an entire school year, and I can say that it has been a challenge for someone who has a child in school. Speaking as a father, and I think it's going to require us to really ask our leaders, local, statewide, and federal, to mind our priorities. And clearly, one of them that I'm concerned about in this 2021 session of the legislature is that they protect public schools, and if anything, provide for the resources necessary to address what has been a COVID slide. That's number one. The other thing that I think we've lost, perhaps in San Antonio and maybe other communities, is this sense of invincibility. It was a pandemic from outside of the United States that we thought was going to be quarantined to a very isolated evacuation mission that quickly began to overrun our country. And in fact, I was looking at the statistics just recently. The United States has more of the COVID infections worldwide than the rest of the other top 5 combined. That's devastating, considering that we have a very small fraction of the population. We have to do better of minding our priorities. Coming out of this pandemic, education is going to be one of them, but certainly when it comes to how we deal with health in this country and in this community, health has to come first, bar none.
One of the theories I heard was we may be the worst in dealing with the pandemic, or one of considering where our standing is in the world, but coming out of it recovery-wise, we're better positioned to come out faster, stronger, better. That, well, at least we have that.
I agree wholeheartedly. And if you look at where we began, and everyone remembers the moment they saw the aerial photos of our food bank lines, recognizing that 120,000 people in a week were depending on the food bank for food. And that was a wake-up call, because it had only doubled, meaning that prior to the pandemic, 60,000 of our San Antonio families were depending on the food bank for food. Under no circumstances should that be an acceptable thing to go back to. And so we've been dedicating ourselves to fixing what was broken to begin with, that has been laid bare during this pandemic. And as a result, we've made historic investments as a community, without raising taxes, by the way, in workforce development, in housing, in small business relief, in the things that you need to have right fundamentally in order to grow a strong community. A pandemic, a crisis like this, can be a catalyst for change, and our community working together has focused it on the right change, and I think because of that we have as strong a foundation as any in the country to come back stronger, more equitable, and more resilient as a community.
You agree with that?
Yeah, I do. In fact, our economy is holding up much better than I thought it would be holding up.
Well, people are all moving here,
Yeah,
which is,
well, that's part of it. That's certainly part of it.
we're not New York and we're not LA.
I think that's part of it. Where we are hurt, and it'll take a while for it to come back, that's the tourism industry. And so when the mayor put in place the program that he submitted to the voters to do job training, a lot of these people need to be changing and thinking about their future and getting some skills so they can make a decent living. So it's going to take a while to get back. But if you take away the tourism industry impact, we're doing very well. And we never did totally shut down the economy. That was a misnomer. There was elements of it that dealt with the public that did shut down for a while. And we are helping. I know we've made over $20 million in grants to small businesses. I know the city's even probably double or triple that. Then businesses also got the payroll protection plan. So we've all reached out to try to keep them healthy and make sure that they're going to be able to prosper. And I think they're, outside of the tourism industry, I think they're doing very well.
Okay, so you're in a room with the mayor of LA and the mayor of New York. And those guys look at you and they say, how'd you get through this so easy?
Yeah. Well, you know, New York was an unusual deal because you're just jammed together, you know. I think there's as much as 7 million people on that little tiny Manhattan Island when they come in on the subways. And so they had a unique problem. LA, I must say, they're spread out and they still had a big problem. Now, you know, it takes local leadership to be able to convince. If people decide they're not going to follow these things, then nothing works. And I think our citizens have done a very, very good job of that. Now, we do see a lot of deaths, but we also know that San Antonio has a high degree of diabetes, a high degree of obesity, high degree of heart problems, and we know those are by far the most vulnerable people. But I think our citizens have done a good job. You're always going to have people that refuse to do anything. There's a little good article in the Wall Street today, something like 20% will never take the vaccine and will never wear a face mask.
Well, what do you have to say to the mayor of LA and the mayor of New York?
It's quintessential San Antonio. You know, San Antonio is a very special community, and it's exemplified by our favorite team, the Spurs. We always talk about how that team works and how they build champions. It's through teamwork. San Antonio, our community, Bexar County, has come together like you would see very rarely, even in Texas. Our community has stuck together, has stayed coordinated, has kept focus on the mission, and to me, that's what's gotten us through. Again, not unscathed, but we've saved lives by working together, and we're going to come back stronger because we're working together. San Antonio is a community that rallies, that helps neighbors, and that's, I mean, it just makes you proud. I'm proud to be a resident of the city. I'm honored to be mayor, but I'm proud to be a resident of the city.
Let's talk two events, Fiesta and Rodeo. The Houston Rodeo just canceled even their May offerings.
Well, you know, we've gone back and forth. I started expressing reservations way back in December, and the feeling then with them, hey, look, February's a long way off, we might be better. They made some concessions, and I thank them very much for doing that. Not doing the big carnival was a big step. We did help them out with $750,000 in donations for some scholarships. And so I know they're trying to do the right thing. But what's different now than what was different in December is these other three devastating iterations of the virus that's around, and that could really hit us. We're on the downslide and we're controlling things better, but we don't want to end up back. So I did ask them to postpone. As you know, the Houston Rodeo and Stock Show postponed to May, and then just today they announced they're not going to even do it in May. Austin Rodeo postponed or canceled. Fort Worth Livestock Show did. So they have the right to do it. They have a leasehold interest. I believe they will do their best efforts. We'll try to help them in any way we can with our emergency office department, with the sheriff's office. But they're going to have to be able to do just like what the city did when they had the football game. They had to really stay on top of it. In fact, I saw your police chief just coming in. I said, I understand you had a tough job at the Dome. He said, yeah, we did, because they had to remove people that refused to wear the face mask. And so I've told the rodeo people, you're going to have to be willing to do that. And I think they will. I think they'll use every measure, hopefully.
Cody says they will. Cody says they're ready.
It's very difficult, very difficult.
Is that one of those things that if you had known then what you know now, you would have pressured the rodeo not to make any plans in December?
Well, I tried to do that verbally back in December and then kind of backed off, as you stated, that, hey, it's 2 months away. We'll see if things will get better. And they are getting a little better, but we still got a big problem ahead of us. And I think they're determined to go ahead with it. But I've just said to them that you're going to have to be extremely careful. 1 person out of 100 would have COVID. I think that's what our health official said yesterday. 4,000 people going to an event, 40 of you walking in will have COVID and very easily spread it to anybody else unless you're being very careful, keeping the distance, keeping the face mask on.
So are you going to go to the rodeo this year?
I'm not going. I will go to the livestock show.
Okay, and the same question to you. Fiesta, you just killed us with Fiesta. You really think it's going to happen in June?
Cautious optimism is how I would describe it. But again, I think we have to be ready for the fact that conditions will dictate what we do with events. We are rolling out vaccines. We're looking to see if we can get immunity up. But I think what the judge has said is right. We're in an era of community spread. We've been there for a year. If you go to the grocery store, there's a really good chance you're going to run into somebody who has COVID. So what you should do, whether you're in your own house, or you're in a facility, at a shopping center, or you're at an event, you have to behave as if the person that you're near has COVID. So unless you're willing to do that, you don't belong going. You shouldn't go. And we have to enforce it that way as well. So wearing a mask, keeping people distant. As the COVID virus eases up on our community, maybe those restrictions will ease up too. But I think we have to be prepared for that reality and see where it takes us. But I think it's a good thing to be optimistic, but also we have to be cautious and realistic at the same time.
If you were going to put a percentage on whether Fiesta would go forward in June, where would you put that?
I would say it's hard to say, but I think at the rate we're going, if we can get more vaccines into this community from our federal government and our state government, I would say there's a better than even chance that we can do things, albeit modified by the summer.